lot of people ask, where are the incisions for the vertical restore? I think it's a great question. Obviously, everyone wants to know if it's going to affect their hairline, if it's going to affect the way they wear their hair. And the answer is, it really shouldn't affect anything with respect to how you like to wear your hair. You know, women like to wear their hair in a ponytail, no problem. We're conscious of this and created an incision design that hides it, as well as the fact that there's no tension on the skin, and the actual incision line heals so fine that with a little bit of healing time, the rest of the incision is basically imperceptible. Because the vertical restore and the vertical prevent address the lateral brow, the midface, the jawline, and the neck, we're going to start our incision up in the top of the hairline right in here. And I give it about 1 centimeter to 2 centimeters of space, depending on how much movement I believe the lateral brow segment is going to do, so that this patch of hair will still be in front of the incision. So we make the incision up here, and it's usually a moving line. It's a zigzag type of an incision because the eyes have a hard time finding that type of movement as opposed to a straight line. Then when we come down to the level of the temporal tuft, we want the incision to be at the hairline. And the reason we want it to be just at the hairline, just behind it a little bit, is because we don't want this temporal hair tuft to shift. One of the telltale signs of facelifts are that this hair ends up going from here to here, and that's because when the skin gets removed, all that hair gets removed. So we want there to be a nice natural temporal tuft, and as a result we need to convert this incision to a hairline incision. And the way it's done is it bevels the hair follicle, so you get some hair that actually grows through the scar and hides it even further. And then once we get down to this area of the ear, we're going to use the natural shadows and contours of the ear to further hide it. So we go into that little groove right there, and then we come behind the ear there, and then as we come down to the bottom of the tragus, we'll make a cut across here so that this unit and this unit become completely isolated. And whenever you have movement in the lines are hard to follow visually. So then once we've done that part there, we're going to come basically here and go behind the ear, and from there we're going to put the incision in the natural ear sulcus. So it's way deep in here. I'm sorry, I'm going to turn your head a little bit. So it's deep in here, right in the natural crease, so you can't see it. And then we're going to bring it up to a certain level, and then from there we're going to convert it to behind the hairline incision right here. And what this is going to do is going to allow the incision to hide within this hairline here, but also allow us to be able to remove skin going in this direction. Because the vertical restore vector is upward, and the next skin is going to be removed in this horizontal fashion right here. So we're going to, and the length of this incision is dependent on how much laxity there is in the skin. Some people who are younger and they don't need a whole lot, the incision might end right here. Older patients, it might go down a little bit further. Basically, the incision under the neck will be right in the natural crease underneath the chin, hiding really well, so when the head is down, you can't see the incision. Okay, so that's the extent of our vertical restore, vertical prevent incisions. The quality of the incisions heal really well. They hide in natural contours, can't see them. This gives you an idea of the natural direction and vectors of lift that we perform as part of our procedure, everything going upward. I hope you enjoyed the video. Please subscribe to my channel to see more secrets and demonstrations in the field of plastic surgery. Thanks so much.